In the title, Depth Hypnosis, there's the term hypnosis. And where does that fall?
As I mentioned, depth is referring to the deeper levels of the self that one can access. And I use the word hypnosis for several reasons. One is because people living in the mainstream think of hypnosis as something that takes you beyond where you would normally go. And there is a tradition of using hypnosis for stopping smoking or helping people stop overeating. And so I thought it would be a place where people would look for relief. And yet I didn't want to have something that was just, come here and think about this label on something, right? I wanted people to understand that they would be going into another place. And hypnosis helps you get that idea right away, because it is in the mainstream probably the main concept of working in an altered state that there is. I mean, these days meditation has become more known, but when I started with depth hypnosis in the mid-90s, although here in California meditation was known, it really wasn't known throughout the other parts of the country, and certainly not in Europe as a therapeutic intervention. So I was looking for something that provided some information about, okay, we're going to be going into a different place. We're not going to be doing too much, conceptualization just on the mental level. We're going to be working in an altered state, but it doesn't have to be in a kind of prescribed religious way of getting into the altered state, such as prayer or meditation, because I wanted people from any spiritual tradition, including the scientific traditions, to feel comfortable accessing the hypnotic state. So I used that word, hypnosis.
Great. And regression therapy, that's part of depth hypnosis in some ways.
Regression therapy is a huge part of depth hypnosis. And we use the regression work as a way of moving deeply into the self. So once we have worked with understanding the presenting problems that a person has, once we have understood the emotional context in which those presenting problems are arising, and once we have helped a person connect with this part of the self that has only the highest good as its sole intent, then we are ready to use the regression processes as a way to begin to navigate deeply into the self to find the roots of the symptoms that they have come for help with. And so in regression therapy, basically what you're doing is you're going across time. We have a process where we help a person move perhaps into a time earlier in their young adulthood, or perhaps a time in their adolescence, or perhaps a time in their childhood, or they may even be drawn into a time when they were in their infancy, or even when they were in their mother's womb. And we also work with the concept of past life regression, which can be a little bit of a challenge for people who don't believe in past lives. But I always try to encourage people to think about the concept of past lives as an other life. It's an aspect of yourself that you may not be fully connected with. You don't have to believe in past lives, but you just need to consider that there may be another way of understanding what your symptoms are, and a past life experience will give you a very good understanding of a different way to look at the roots of symptoms. So when people move into an experience where they are actually reliving the experience of where they felt traumatized, or where they felt that they were losing a sense of themselves, or losing power, or feeling very interrupted by another person, or feeling like they were absorbing another person's negativity, then we move in again with the participation of that part of the self that has only the highest good as its sole intent, so that they are not just re-traumatized. And we have a process where we help them change their relationship to the event that they're experiencing so that the charge of that experience lessens, and therefore the power of the symptoms that it's driving also lessen.